Hello, and welcome to the Insider's Guide to Winning with Bundled Payments from PeerWell. PeerWell makes a mobile app that replaces the 50-page pamphlet used to prepare patients for major surgery, like joint replacements. Today, I'm going to talk you through what bundled payments are, why they matter, and tell you about the two biggest levers you have in reducing bundle costs. But first, why talk about bundles? Well, the answer is pretty straightforward. The Centers for Medicare and Medicaid have stated that by 2020, 50% of fee-for-service payments will transition into alternative payment models led by bundles. This means in 4 years, we will go from less than $1 billion in bundled payments to $240 billion. This represents massive change in the biggest segments of inpatient care. Now, some of you may be skeptical that this will happen, but predicting the behavior of Medicare and therefore all insurance doesn't require a crystal ball. It just requires looking at what they have done in the past and what they are actively rolling out. In 2013, Medicare enrolled 450 health organizations in the Bundled Payments for Care Improvement Initiative. In this, they tested different bundle payment structures. Model 1 focused on acute care, Model 2 on acute care and post-acute care, Model 3 on post-acute care only, and Model 4 tested a prospective payment version of Model 1. The Comprehensive Joint Replacement, or CJR program, is just Model 2, focused on hip and knee replacement. Now, why joint replacement, you ask? Well, 40 million people in the U.S. have arthritis. Moreover, joint replacement is the most common, most costly inpatient procedure funded by CMS. To understand how the bundle works, let's follow Susie on her journey. She has been suffering from knee pain for a number of years. After trying many solutions, she and her surgeon decide it's time for knee replacement. She is given a thick stack of preparation instructions, checklists, and a joint prep class schedule, but before she knows it, her surgery date has arrived and she is admitted to the hospital. The surgery goes well, and she is discharged under MS-DRG 470, joint replacement without complications. This discharge code flags this as a bundled event. The episode of care here is everything that happened since Susie was admitted to the hospital through her discharge plus 90 days post-discharge. This is the critical part of the bundle. The hospital is held responsible for the cost of the entire episode of care, but all caregivers still bill Medicare directly under fee-for-service. So, when the hospital discharges the patient to another provider, it has responsibility for but no visibility or control over what is billed. 85% of joint replacement patients are discharged to an outside care provider, not home. According to the data, the vast majority of the time, the bills stack up and exceed Medicare's allowable bundle price. When the end of the year rolls around, CMS will see Susie's discharge flag and add up all the costs billed for her episode of care. If her costs are less than the price they allow for the bundle, the hospital gets a reward. If her costs exceed the bundle price, CMS penalizes the hospital for the overage. Fully phased in, this penalty can be up to 20% of the episode of care price. This reconciliation is done as a roll-up of all patients discharged per year. Today, most hospitals exceed the bundle price. The goal for CJR is to force hospitals to quarterback care and cost for patients for the entire episode of care, not just what happens in their facility. Once care and costs are under control, the hospital is set up for bonus payments and higher volume. So how do hospitals improve care and reduce costs, especially if they don't control the most expensive part of the episode? The first lever to control bundle costs is to improve patient health prior to surgery. CMS data shows that CJR episode costs goes up in a linear fashion as the number of chronic diseases increases. Most CJR patients have 4 to 5 chronic diseases. Making sure these are well controlled prior to surgery is critical to ensure a good outcome. The second key lever is to manage what happens when the patient is discharged from the hospital. Today, 85% of patients are discharged to a post-acute care provider. Most of those patients are discharged to a second post-acute care provider. This comes at a significant cost. If a patient is discharged to a SNF, the episode cost has doubled and blown the top off of the bundle price, which is about $25,000. So how can the hospital, who owns all financial risk, manage post-acute care costs? Well, the hole-in-one on this procedure is having a patient who is ready to go straight home. If a patient can't go straight home, then you have to navigate the world of post-acute care. This is not to say that patients should be sent home if they are not able. The reason CMS set the period at 90 days is that there is ample time for readmission. Discharging the patient home responsibly requires that they show competence on activities of daily living and they have a caregiver, both of which are a result of how strong, healthy, and prepared a patient is before the surgery. That's why pre-op prep is so important. A study with over 4,700 patients showed that 1 to 2 hours one-on-one pre-op prep focused on prepping the home and training on how to use assistive walking devices yields an average drop in discharge to a post-acute care facility of over 30%. The problem is, most patients struggle to follow the instructions in the prep manuals that they are given, and burdening already overworked clinical staff with one-on-one patient preparation is difficult and costly. PeerWell helps patients be as healthy and prepared as possible by making this process dramatically easier. Patients are given a 4 to 5 item daily checklist of tasks that prep them day by day. Tasks cover anxiety and mindfulness-based pain management, exercise so they can practice the activities of daily living they will need to show proficiency on in the hospital, nutrition so their body can heal, home prep and walking device training. This content is served in size 16 point in language calibrated to the 6th grade reading level. Our tasks look more like comic strips than books. The program comes loaded with video, guided audio, and interactive patient status measurement. Also, PeerWell has integrated with Lyft to help patients get to their surgeries and to their post-op appointments. But let's say the responsible thing to do for a patient is to discharge them to a post-acute care setting. How can you help control costs? The first step is developing true partnership with doctors. Doctors determine discharge location, help determine standards for care settings, and influence patient choice of post-acute care provider. Unfortunately, surveys show that most orthopedic surgeons do not believe the hospital is their strategic partner. Involving doctors early in bundle program care design is essential to building something that works. Gain sharing is a relatively plug-and-play feature of CJR and can be a great way to get everyone on the same team. Lastly, curating your post-acute care provider network is a powerful way to ensure cost and quality. Of course, you cannot impede a patient's ability to select their provider, but you can suggest where patients go. Selecting post-acute care providers should be based on whether they meet operational standards like standardized admissions and good electronic records. Also, you should examine their care planning protocols and their staffing to ensure patients that go there stand a good chance of achieving great outcomes. In conclusion, bundled payments are coming. They are episodes of care with defined prices that the hospital is responsible for achieving, even if they don't directly control everything that is billed. The best way to control bundle costs is by getting patients ready to go home after surgery through proper patient preparation. If the patient must go to a post-acute care provider, make sure your team is aligned from hospital to doctor to post-acute care provider. Thanks for joining PeerWell for our journey through bundled payments. Let us know if you have any questions or comments by emailing info@peerwell.co.